Hi, I'm David Klein. I'm an orthopedic hand surgeon at Kennedy White Orthopaedics in Sarasota, Florida. In this orthopedic moment, I wanted to talk to you about finger sprains. A finger sprain is one of the most common activity injuries involving the fingers. They actually come by different names, even though they represent the same thing. If you come from Pittsburgh, Pennsylvania, you'll probably call them stove fingers. If you come from New York, you'll call them jammed fingers. But the bottom line is, this is a ligament injury, usually to the proximal interphalangeal joint of the finger, that comes from hyperextension or from a longitudinal load to the finger. Sometimes in its worst form, it may actually cause a dislocation, which can be temporary and pop back on its own, or it may have to be put back in position either by yourself or by somebody else. One thing about finger sprains that people often overlook is that the stiffness that comes from them lasts a really long time. It's very common to have stiffness at the finger for 6 to 9 months, sometimes even longer, with persistent swelling, sometimes up to a year, even after what seems to be just a moderate sprain to the finger. Also, usually motion is the best treatment. Splinting, while it may be helpful for the first few days, typically will present with a very stiff finger that will have much more difficulty getting your motion back later compared to getting your motion sooner. While I'm not treating you in this video for your finger, you may need to see somebody, such as a hand surgeon, to help guide you for proper treatment. The two things that I find for most patients tend to help are elevation and working on complete composite motion of the fingers to prevent stiffness. Also, be patient. It really does take a long time to get better.